early on, I was just saying, listen to the CDC and Dr. Fauci. That's what we had always done. Now, they got a little adulterated along the way, but that's how we had managed things. We did it with H1N1, we did it with HIV and AIDS, and that's how we managed pandemics. But suddenly, journalists had a vote. That was disgusting, and that was a mess.
That's true. Actually, it's interesting that journalism and the media in general, they actually took on a countenance where they, in a sense, they felt like they were some arm of public health, maybe the communication arm of public health. And they took that very seriously. But one of the great shortcomings is we didn't see a broad interchange of ideas. As a cardiologist, we encounter illnesses where we don't know what's going on. And we call what's called Bethesda meetings. We meet in Bethesda, Maryland, the NIH, CDC, FDA, academia, industry, practicing doctors, and we have an agenda. We go over it. We never had Bethesda meetings on COVID-19. And when I testified in the U.S., I published this later on. I said, listen, we should have had a broad approach. We should have had a team of doctors working on reducing spread of the illness. That's the first pillar. Second pillar is we treat early to prevent hospitalization, death. That's the most important thing, stopping these hospitalizations and deaths. Third pillar is do the best we can in the hospital and improve hospital protocols. And the last is vaccination. But we never saw that broad approach. We basically were told lockdown and wait for a vaccine.
And how just suggesting from a collegial point of view that we continue to do morbidity, mortality reports and things the way we've always done them, and have, grand rounds on these issues, whatever it might be, is like you're saying, the Bethesda meetings, whatever they are, that we go on doing medicine the way we always have, which is really always analyzing our choices rather than silencing everybody and going by fiat. That is one of the oddest things I've seen in the certainly in my career, when we were trained around the same time, right? And I've never imagined anything like this. That to me is and why aren't we having a large scale review of the strengths and weaknesses of the approaches that were taken, and really analyzing dispassionately what states got it right, what states got it wrong, what things did work, what things didn't work? Shouldn't there be a large scale sort of MMR review?
Well, sure. I look back on it. This is such a big part of people's lives for the last now going on 3 years that we should have had monthly reviews. How come not a single local or national TV station had a review on what somebody should do if they got COVID? We're our third year into it, and there's still no care plan. People are handed a test result and said, good luck. And you think we're 3 years into it, there would be a care plan of step one. This is what we should use. I've been a big proponent of the monoclonal antibodies for high-risk individuals. And from the very beginning, it was enormously difficult to access these, find these, no messaging, no 800 numbers. I'll tell you another shortcoming is research. There was no access to research, no 1-800 numbers, no billboards to get people into COVID research. I mean, as if the human mind simply went blank in the middle of a catastrophe.
Yeah, that's a great way of framing it, because that's exactly what it looked like to me. And monoclonal antibodies, I had alpha, and then I've had it at least twice now, COVID, but the first one was nasty. It was alpha or delta, one of those. And monoclonal antibodies absolutely kept me out of the hospital. I during the infusion, I felt better. It was amazing. And so I went on Instagram and did an Instagram live every night saying, hey, this is the experience I've had. You need to know about this. And what I got back was, because you're special, I'm sure it cost $1,000. No, it was free. Government bought it all up. It was free and available everywhere. Go, check with Caremark, check with your physicians, get this stuff out. You should have access if you're in any way at risk. And still people are underusing monoclonal antibodies to this minute.